Meet Nicole. She is pregnant. Unknown to Nicole, some radical changes to her baby's blood circulation are about to take place. First, let's cover the pathway of her baby's blood as a fetus.
Oxygenated blood from the placenta enters the body of the fetus through the umbilical vein. The blood from the umbilical vein is shunted away from the liver and directly toward the inferior vena cava through the ductus venosus.
Blood from the superior and inferior vena cava empties into the right atrium. Since pressure is greater on the right side of the heart compared to the left side, most of the blood is shunted from the right atrium to the left atrium via the foramen ovale. This blood flows into the left ventricle and then is pumped out through the aorta. A small amount of blood enters the right ventricle and the pulmonary trunk, but much of this blood is shunted from the pulmonary trunk to the aorta through a vessel detour called the ductus arteriosus.
The deoxygenated blood returns to the placenta through a pair of umbilical arteries. Nutrient and gas exchange occurs at the placenta.
You remember Nicole? She is ready to have her baby now. Meet Avery. Now that she is born, her blood has been rerouted to an entirely new circulatory pathway.
Soon after birth, the umbilical cord is severed. The umbilical vein then constricts and becomes non-functional. The umbilical vein then becomes the round ligament of the liver. This is an anterior view of the adult liver. The round ligament of the liver is located directly between the right lobe as well as the left lobe of the liver, and it's encased within the falciform ligament.
When the umbilical cord is cut, the umbilical arteries also constrict and become non-functional. Umbilical arteries become the medial umbilical ligaments. We have reflected the rib cage so that you can see the inside of the rectus abdominis muscle. And you may notice that the medial umbilical ligaments lead towards the belly button.
Without the support of the mother, it is now up to the infant to filter his or her own blood, and the blood will no longer be shunted through the ductus venosus, but travel through the liver itself. The ductus venosus ceases to be functional and constricts, becoming the ligamentum venosum. In this view, we are looking at the liver from the inferior side, where we can see the left lobe as well as the caudate lobe on either side of the ligamentum venosum.
Since pressure is now greater on the left side of the heart, blood no longer can travel from the right atrium to the left atrium. Therefore, the foramen ovale closes. So how exactly does this happen? The interatrial septum actually consists of two layers, called the septum primum and septum secundum. When the baby is born and the lungs are fully functional, blood begins to flow to the lungs. Blood returning from the lungs empties into the left atrium, thus increasing the pressure there. This increase in pressure causes the septum primum and septum secundum to be pushed together, closing the foramen ovale. Here's the view of the right side of a heart. You can see the ascending aorta. You can also see the right ventricle, as well as the right atrium above it, in which you can see the interatrial septum and the fossa ovalis.
Now that the baby is breathing on its own, the blood needs to travel to the lungs to become oxygenated. Blood pumped from the right ventricle into the pulmonary trunk is now directed to the lungs. It is no longer being shunted through the ductus arteriosus. Within 10 to 15 hours after birth, the ductus arteriosus closes and becomes a fibrous structure called the ligamentum arteriosum. In this view, we can see the pulmonary trunk as well as the aorta, with the ligamentum arteriosum connecting the two.